Hi, I'm Jennifer Aldrich. I am a physician at Temple and at the Mazzoni Center, and I've been doing HIV care for about 25 years. I'm honored to be invited here today virtually, and I am going to talk about HIV and COVID in long-term survivors and the twin pandemics. Share my screen. Let's see. All right. So this is for many long-term survivors of HIV, not your first rodeo with a pandemic. And many people have noticed similarities in the two epidemics. Both are caused by a novel virus, which came out of nowhere, it seems, and started making people really sick. And the way, particularly I feel like in New York in the spring, and unfortunately we're heading that way again, the ICUs filled with COVID patients was reminiscent for many of the 80s when our ICUs were unfortunately filled with AIDS patients, many of whom had pneumocystis pneumonia and also required ventilators. Right now, or until this week, we've only had behavioral modifications to really protect us. And many of those messages are probably familiar to those who have been living with HIV for a long time. In the beginning, we only knew that condoms and being careful with partners were our tools for prevention. Just like right now, up till now, and for many people for the months to come, our best prevention is going to be masks and social distancing. Both pandemics have unfortunately really laid bare in our country the disparities where communities of color are disproportionately affected, and where healthcare access and other socioeconomic factors like living with a lot of people or not having the luxury of working from home or needing to take public transportation, which is riskier. All of those things are eliminated in society. We also see that in both pandemics, there has been victim blaming and shaming. If you contract COVID, sometimes people are asking, well, what did you do wrong? And the Asian community has faced a lot of blame and racism, with people calling this the China virus, just as gay men were blamed for HIV. And we've learned about the importance of contact tracing and the roles of our health departments in trying to keep people healthy within a framework of confidentiality. So what's the data on HIV and COVID? So there is, despite the fears that we would see significantly more severe disease, and infections in our HIV patients. That has not been the case. So there are multiple case studies from all over, particularly in Europe and the US, where there really have been no significant differences in outcomes overall with how sick people get, how often they need to be hospitalized, or in death rates. The one exception is a cohort of 286 patients from different places in the US, where more severe outcomes were seen in those who had CD4 counts below 200. Unfortunately, I know that I take care of many older people now, because I've been taking care of some of my patients for my entire career, and they've followed me around in the city. But as we get older, we accumulate other issues. We know that people living with HIV have higher rates of tobacco use, and then there are other comorbidities such as high cholesterol, diabetes, high blood pressure, kidney problems, liver disease, and heart disease, as well as cancer and lung disease, that all are associated with higher risks of severe COVID, but are also seen in greater prevalence in our HIV community. And there's also a study showing that active substance abuse increases the risk of acquiring COVID, as well as having a more severe outcome. Our older people and people in general with HIV may also have more exposures, not only because they're in the demographics where we are seeing more infections, but people are more likely to live in a congregate setting. So in whether that's a group home or an assisted living facility, skilled nursing, or prisons. And in our prisons, we're seeing so much COVID right now. I take care of prisoners in the state prison system. And I did a calculation last week that showed that just from data on their website, 15% of staff in the Department of Corrections in the state have been infected with COVID. And that's staff. As I said, the epidemiology of HIV overlaps with those who are disproportionately infected with COVID. What about our meds that we've been prescribing all these years? There was a lot of hope early on that some of the older medications might actually be useful in treating HIV. For those of you who had the misfortune of being on Kaletra, they did, based on in vitro efficacy, did some studies early on which showed it had no efficacy. Same thing with darunavir, which is Prozista. And Atrazenevir, which is Rayataz, also shows in vitro activity, but it seems that the protease inhibitors have been abandoned. There was one interesting study that showed that patients who were on Truvada had lower rates of hospitalizations than patients who were on Descovy, which has the newer version of tenofovir, or on other regimens. That, I suspect, is probably because patients who are on Truvada tend to have fewer other medical issues and are younger. As people get older and they accumulate medical problems like kidney problems, they get shifted to tenofovir alafenamide, which is the drug that's in Descovy and in Biktarvy and in a lot of other medicines that are co-formulated. Now, there is one class of medications that has shown promise, and that's the CCR5 inhibitors. One of the things that makes people really sick when they get COVID is that it's not just the virus, but it's in that second week when the immune system just gets a little overeager or a lot overeager and causes an over-aggressive response, what we call a cytokine storm. And that's really when people get into trouble in that second week. So there have been studies looking at leronlimab, which is actually on the approval track for HIV, but it did show prevention of progression to severe critical disease in outpatients who took it. It is an oral medication, so you don't need an IV. And there are trials planned in severely ill COVID patients. So that's one CCR5 inhibitor, but we already have one. We have Maraviroc, which is Cellzentry. And that is something that sometimes people end up on when they've developed some resistance to some of the other medicines. It's a twice-a-day medicine, and while it's well tolerated, a lot of people have resistant virus to it already. So we don't have a whole lot of people on Cellzentry. But interestingly, there are trials enrolling in HIV negative patients with confirmed COVID to see if it also has similar efficacy like leronlimab. For those of you who see your providers regularly, you'll have noticed that there have been some changes. We're doing a lot of telemedicine now. And that is harder for people who are older. So that, there's a lot of technology coaching that we do. And then there's also the issues of privacy and confidentiality. When you're talking to somebody and they may not have disclosed their status to the people they live with, so that's an issue. I've had patients actually do their telemedicine with me on a bus for that reason. We are becoming creative with laboratory monitoring, but we know that less frequently is okay if people are stable and healthy. We're also seeing that it's taking longer for some labs to return because the national labs like Quest and LabCorp are really overwhelmed. So that's in particular been a problem in my prison patients where labs were taking 2 weeks to come back because the lab that they use was just dealing with so much COVID across the country. Not surprisingly, people still do have sex in the time of COVID. So we've also learned to, for those who are at risk, to mail swabs. I do that routinely now. Interestingly, there's a national swab shortage for the swabs that we use for detection of gonorrhea and chlamydia, because they're the same swabs that can be used to check for COVID. So that is something that we are also managing. And how do you have safe sex from a COVID perspective? If you don't have a regular partner, this is a really long time for people to be isolated. And I can guarantee you that sex is still happening. So it's our job to try to give advice about how that is best done safely in terms of knowing your partners and limiting duration and other measures. There are other things that we've found that support groups and substance abuse support groups are not meeting in person. And that is a challenge for many people. We have economic insecurity, so a lot of people are losing their insurance. And we are utilizing Ryan White funds significantly more as a result. We are seeing more homelessness and more food insecurity, where people need help. And that is something that we're screening for in our visits. We know that isolation leads to poor mental health outcomes, and our older patients may already have smaller networks because of losing their peers at the beginning or during the last 20 plus years. And we know that sometimes people have less family support, depending on their circumstances and acceptance. Unfortunately, we're seeing a lot of people relapse into substance abuse. And that has been, EMTs across the country have reported that they are seeing double the amounts of cardiac arrest calls due to overdoses. And Philadelphia, sadly, is on track for having a record number of opioid overdoses in 2020. So what are some lessons that we can learn from HIV that have been or can be applied to COVID? Well, I think we learned that public health messaging needs to be appropriate for the people that we're trying to message. And it just can't come from doctors. We need every member of the team to help us get the information out to people. And we can't do any of this without involving the community. And we certainly learned that with HIV. There is much that we can do to control COVID, even while we await a vaccine for everyone. And that's certainly a lesson we've learned from HIV. And much of the infrastructure that has been created as a result of the HIV pandemic has allowed for us to make progress in such a rapid time with COVID. We have volunteer networks for trials. We have come so far since the 80s in terms of molecular-based testing. Everybody now knows what PCRs are, but that certainly wasn't the case in the early days of HIV, where we now talk about viral loads and apply it to COVID as well. And we already had a lot of work done for many of what have turned into successful vaccine vectors. So even though we don't have an HIV vaccine, there's been a lot of work. It's also one of the things that I feel is important is that understanding that we're human, everybody's human, and we can't just be black and white about don't do this, don't do this. People turn out those messages, tune out those messages. We are much more effective when we are realistic and work with people. And that has always been the case with HIV, and is certainly the case with COVID. Know what your risk is, know that of the people that you are associating with as much as you can, and take the appropriate precautions. And there's, safer activities and less safe activities. And finally, we've certainly learned that politicians can be obstacles. In the early days of HIV, when a president didn't want to name HIV and AIDS, versus now when we have denial and discouragement at the very top, which has certainly not helped. But there is good news. So there are, as you know, there are vaccines coming or have been just approved. What is super important is that all of these trials in the major vaccines have included HIV patients. And that's because of advocacy you know, our advocates have gotten us to where we are in so many ways today. The Pfizer vaccine is mRNA based, so that uses it's a way of teaching the infected cells to produce a response. And that has shown 95% efficacy. Of course, it has to be kept super cold and is 2 doses, 3 weeks apart. So that's going to be challenging to deliver. The Moderna vaccine, also similar efficacy. So that's awesome, another mRNA-based vaccine. It doesn't require the deep freezing that the Pfizer vaccine does. So that should be easier for many facilities to deliver. There's the Astrazeneca and Oxford vaccine, which has shown 70% efficacy. Unfortunately, there have been some errors in their trials and some hiccups, such as accidentally giving half dose of vaccine to younger cohorts, but then seeing better responses in the accidental dose. So the jury's still out on that one. In trials are the Johnson & Johnson adenovirus, both the AstraZeneca and the Johnson & Johnson vaccines use adenovirus vectors. Johnson & Johnson is looking at both 1-dose and 2-dose schedules. And then there's a Chinese vaccine that has been approved for emergency use in the United Arab Emirates. And reportedly, though people haven't had a great chance to look at the data, shows 86% efficacy. And there are a number of other vaccines in phase 3. So I think the message as someone living with HIV is that the trials we will have data on efficacy in HIV patients as well as safety. A little bit more about the Pfizer vaccine. So there were 1,300 HIV patients in that trial. Most of the trial data just shows mild reactions, but there have been these 2 significant allergic reactions in terms of anaphylaxis. And that's post emergency approval, so given to the general population. They excluded people with serious allergies in the trial. So this may be something that we're discovering post-marketing, similar to how, with HIV meds, sometimes you discover things after things are approved. But this is getting so much scrutiny that we should have more information soon. But for right now, the UK is recommending that those who have had significant allergic reactions, such as anaphylaxis, or if you've had something like Stevens-Johnson to Bactrim, to hold off on getting until we have more data. What's really great is that older people produce stronger immune responses to the vaccine than younger people. So that is encouraging. So what can you do as someone living with HIV in the time of COVID? Have a good supply of your medicines. And if you feel like you need to go to the hospital, bring your medicine with you, because your medicine might not always be on formulary, particularly if you have a more complicated regimen. Please stay in care. We want to hear from you, and we can help you stay healthy during this time from an HIV standpoint. Remember that getting really sick and getting steroids, both from the natural steroids that you release and the steroids that we might give you if you have COVID, may temporarily lower your CD4 count. So probably not a great time to check that. It's always a great time to stop smoking, but particularly now, it's a great time to stop smoking, and your providers can offer help with that if they haven't already. And do your best to make sure that all your other medical issues are in the best control they could be. So if, get your blood pressure under control, try to be on top of your diabetes. And of course, wear your mask and social distance. And I will end there be happy to take questions. Thank you.
Good morning, everyone. My name is Michael Tyler Ramos. I am the founder and executive director of MTR Therapy. I am also an LCSW in the state of Pennsylvania, New Jersey, and Florida. I am also a certified EMDR therapist and a certified advanced alcohol and drug counselor in the state of Pennsylvania. Today, I will be discussing wellness and COVID, identifying challenges and promoting resilience. I'd like to start off with a moment of silence and acknowledge those who are no longer here with us. Thank you. So in every presentation I give, I think it's important to start with location of self. So here are some of my dominant identities. I'm from 119th Street and Lexington Avenue in Spanish Harlem. I am an avid and huge New York Mets fan. I identify as a white passing Puerto Rican. I grew up with hip hop. And I also identify as gay. Here are some questions I'd like for all of you to think about and reflect. Name a challenge you currently have. Was this present before COVID? What do you need and from whom? Do the days feel longer? Are you forgetting things? Has your sleep changed? What about your appetite? Are you experiencing mood swings or no mood at all? Is it harder to focus, to stay on track with things? How are you managing? Here are some objectives for today. Define wellness and identifying challenges and maintaining it. The connection between mental health, trauma, and COVID. Staying connected. I will identify simple strategies that may be useful for you. And identifying needs. So here's a refresher regarding social distancing, as new restrictions are in the pipeline and in some places are already here. Stay at home as much as you can. Avoid public spaces and mass transit if possible. When out, maintain a distance of 6 feet between yourself and others. When out, wear a mask to cover your mouth and nose. So here's a working definition of wellness. Wellness is a state of being in good health. It is the pursuit of your best possible health and well-being. It is also a conscious state. When I think of wellness, I think about all our different parts. So if you were to reflect on each category, these are different parts of you, and each part has needs. As humans, we are social creatures. There is a spiritual component for some of us. There is the challenge of financial security, as well as navigating financial stress. The environment and community. Where do you live? Do you feel safe? Your emotional being. Humans are emotional creatures, I often say. We react and respond to things. Intellectual capacity and presence. Physical. Are we navigating any medical conditions? This includes HIV. Occupational stress or lack thereof. Are we underemployed, employed, or not employed at all? So when you look at this wellness wheel, I want to encourage all of you to begin maybe rating the level of stress as well as identify needs in each part. So I think it's important to distinguish between wellness and triage. So one way I frame it with my clients is wellness is ongoing. There's a level of frequency attached to it. This includes, working out regularly, taking walks, meditation, mindfulness for some folks, spending time with loved ones, spending time with chosen family and friends. So I think it's important to understand that difference. Whereas triaging is in the moment. I am feeling stressed out right now. What can I do right now to feel a little bit better? And I think when we're able to separate wellness and triaging, I think it allows for better navigation of stressors in our lives. So the connection between HIV and COVID, here are some. So anyone living with HIV is at an increased risk from COVID if they have a low CD4 count and/or are not in treatment. You want to ensure that you have ample supply of medications, and you want to stay connected with your provider and support systems. This includes the community. So when I think about mental health, there's a direct connection with emotional well-being. And I think it's important to understand and also know the difference between depression, anxiety, trauma, and grief. I intentionally inputted these four categories in this presentation because I think this is what we're all navigating right now. COVID is a collective shared trauma. We're all impacted by it. Grief. We are all grieving what life was before COVID. Some of us are grieving lives lost. Whatever challenges you were navigating before COVID are still in play. Add COVID, add isolation, add racial justice, and a polarizing political climate and election. Tell me, how are you feeling now? This is an example of intersectionality from a mental health perspective, understanding how these things intersect with each other. So as I mentioned, if you were struggling with mild to moderate depression before COVID, your depression levels may be in the moderate to severe range. So I think it's important to do an inventory before COVID, during COVID. Trauma and acute stress. So trauma is a response to a deeply distressing or disturbing event that is overwhelming for us. Acute stress is the resulting feelings of helplessness, a diminished sense of self, anxiety, depression, and or feeling of numbness. Some of you may be experiencing both. If you experienced trauma in the past, your trauma network may have been reactivated because of COVID and the protests. So here are some symptoms to keep in mind as it relates to trauma and acute stress. You might feel nausea, dizziness, muscle tension, body trembling, perspiration, your altered sleep patterns, changes in appetite, pupil dilation. You might experience a spike in blood sugar, headaches, gastrointestinal problems, and heart rate increase. Signs of acute stress include restlessness, insomnia, nightmares, emotional outbursts, irritability, relationship problems, difficulty focusing, and feeling unmotivated. So what do I do? I think it's important to pace yourself. Slow down if you can. Stop if you need to. Breathe. Take a moment to reflect and ask yourself, what do I need right now and from whom? What can I do? Develop a wellness plan. Tell the story of the following 3 people. Who are you when you're feeling really good? Who are you when you're feeling a little bit off? Who are you when you're completely feeling off and disconnected with yourself? I think it's important if you can tell the story of each person, you can hopefully navigate the stress when it happens. Focus on what you can control, not what's outside of your control. For example, we can't control the restrictions, but we can navigate them within our control. We may not be able to physically be in the same room with loved ones, but we can FaceTime and Zoom with them and still stay connected with them. At the same time, I think we all need breaks from the screen. Our Zoom fatigue is a common narrative that I hear, but in reality, I think it's screen fatigue. So we're doing online meetings. We're also watching television, maybe even going on Netflix binges, and also navigating social media and other platforms. So I think it's important to manage and control your notifications on your phone. Take a break from social media and just take a break from the screen if you can. Stay connected. Try to create a daily goal. Keep it simple. Maybe even a gratitude list. Try and hold both. It's really bad right now. However, I'm grateful to still be alive. I'm grateful that I still have my home. I'm grateful for X, Y, and Z. This is not easy. So I want to tell you that up front. I'm not trying to blow smoke in your direction. I'm just trying to keep it real. Sometimes this can be grounding. Acknowledge what is happening, even if you don't have the words to fully describe it. Start a new hobby. This can include trying a new recipe. Watch something funny if possible. YouTube works for me at times. Keep it simple. It's really rough out there right now. Staying connected. What does this look like? So, staying connected with your provider and support team. This includes case managers, therapists, medical providers, and so forth. Instead of texting, connect via video. The center has lots of support groups. Many organizations have support groups out there right now. Tap into them if you can. The Elder Initiative is another good resource. Philadelphia Fight and the Mazzoni Center. I want to say thank you with peace and love from the MTR family. The days are not easy, and there's no end to this in sight. However, try to remain positive and stay connected with those you love and hold dear to yourself. Thank you again.
My name is Lourdes Gonzales. I'm a medical case manager at Action Wellness. Today, my colleague Shakeera Wynne and I will be covering COVID resources for long-term survivors. Our presentation will include COVID healthcare and PPE, applying for medical benefits, food stamp benefits, and other benefits, food resources, housing and utility resources, legal services, phone and internet services, mental health, domestic violence, and addiction services, and linkage to medical case management. Throughout the presentation, you will notice that some of the wording is highlighted in green and underlined. If you click on that, it will take you directly to the website of the resource itself. Our day-to-day needs have changed quite a bit. We now have to wear masks, and some people feel safer when they wear gloves as well. However, these things can be expensive and oftentimes are not available in stores. Some community members and agencies have implemented programs to assist with getting free products such as masks and other protective gear. These programs include Get Us PPE, Fishtown Free Mask Project, and Sew Face Mask Philly. You can obtain more information regarding these programs by clicking the links in our presentation slide. If you or someone you know is in need of medical coverage or supplemental food resources, Action Wellness and Benefitly are two agencies that can help apply for county assistance benefits. You can also apply online at www.compass.state.pa.us. The Change Center is also available at 215-560-7226, and they can assist with any questions regarding county assistance benefits. People living with HIV and needing assistance with medication coverage can apply for the state's Special Pharmaceutical Benefits Program, and usually a case manager will assist with this process. There are a number of food resources available, and Why Hunger is one of my favorites because you can just call or text their phone number with your zip code, and a list of local food banks is provided. Their phone number is 1-800-548-6479. For HIV-specific food banks, a medical case manager can assist with a referral to Babashi, Mazzoni, and ODAT. There are also COVID-specific programs such as the Share Food Program, as well as select older adult centers. Additional information can be found in our slides.
If a person is in need of assistance with housing costs during this pandemic, there are various options that can be applied for to cover these costs. The AIDS Fund All Walks of Life grant can be used to assist with back rent, owed mortgage, or moving costs up to $1,000, or owed utilities up to $500. These funds are only available to individuals that have a housing subsidy. APM has a new housing assistance program through the La Casa Project. This program will assist low-income individuals that have lost some or all of their income due to COVID maintain their housing by covering their rent and utilities for up to 2 years. EFSP is a grant that is sponsored by the United Way. This can assist with covering the cost of current month's worth of rent, mortgage, or a utility. Even though this resource is not only for people living with HIV, the grant funds must be applied for through an agency that receives these United Way funds. The Public Health Management Corporation has two funding options to assist with housing costs. The COVID Emergency Financial Assistance Grant is available to assist with moving costs, owed mortgage, and back rent, as well as owed utilities. This grant can cover up to $2,500 per household per year. The shallow rent application assists individuals that have lost their income due to the pandemic. This grant will assist applicants with covering 3 months of rent. This grant can cover an additional 3 months of rent if needed. To apply for each grant, a case manager is needed. There is a variety of grants and programs to assist with utility bills as well. The Low-Income Home Energy Assistance Program, also known as LIHEAP, helps households living with low incomes pay their heating bills in the form of a cash grant. Households in immediate danger of being without heat can also qualify for crisis grants. The cash grant is a one-time payment sent directly to the utility company or the fuel provider to be credited on the bill. Philadelphia Electric Company, also known as PECO, has a customer assistance program, which is better known as CAP, that can give individuals that need assistance with maintaining their electricity a monthly credit on their PECO bill. The credit is based on the household's gross income and energy use. Philadelphia Gas Works, also known as PGW, also has an assistance program. PGW's Customer Responsibility Program, also known as CRP, is designed to help low-income customers better afford their PGW bills and to keep their gas service on. The Philadelphia Water Department has various assistance programs that are available to customers that are low income and those with special hardship, including losing income due to the pandemic. To apply, 30 days of gross household income as well as documentation for each household member is required. USIF provides financial assistance to low-income individuals and families who are facing utility terminations or who have had their utilities shut off. To apply for funds, a person needs to have a notice of termination or be off service for their electric, gas, or water bills and be a Philadelphia resident and have low income. The following agencies have continued to provide legal resources throughout the pandemic. The AIDS Law Project assists individuals living with HIV with fighting HIV discrimination, getting access to health care, completing living wills, appointing a power of attorney, and appealing Social Security disability benefits. Community Legal Services helps low-income individuals living in Philadelphia with appealing supplemental security income, also known as SSI, denials, benefit appeals, bankruptcy, and mortgage issues. The Homeless Advocacy Project is an agency that assists people who are currently homeless or who have had a history of homelessness with child custody issues, child support issues, and issues with public benefits. The Philadelphia Legal Assistance works with Philadelphia residents that are facing mortgage foreclosure, domestic violence, and child support issues. Temple Legal Aid assists low-income Philadelphia residents living with a disability combat various legal issues. These issues can include family law, kinship adoptions, employment discrimination, and public benefit appeals. Tenant Union Representative Network, which is also known as TURN, serves as a resource for anyone that is currently renting an apartment or a home. They provide services to combat housing discrimination and to educate tenants about their rights. All of the legal resources listed are working remotely. However, they are all available by phone. These phone and internet services can assist individuals with staying connected during this pandemic. Comcast Internet Essentials provides low-income individuals and families to home internet for free. This program lasts for 2 months. Verizon is offering Lifeline Plans, which is a government assistance program that offers discounts on home and internet services to qualified low-income customers. The Lifeline program has more information about low-cost phone and internet options on their website.
It's important to note the need for access to mental health, domestic violence, and addiction services during this time. For immediate mental health needs, you can contact the crisis hotline at 1-800-273-8255. That's for 24-hour service. For people who are experiencing intimate partner violence or domestic violence, they may contact the domestic violence hotline, also available 24 hours. That phone number is 1-866-723-3014. Additional mental health services can be found with the help of CBH or Community Behavioral Health. That is for people who are covered through Medicaid, and Magellan is a point of contact for people who are covered through Medicare. For harm reduction and addiction services, Prevention Point is a great contact for needle exchange and other harm reduction services and case management. Their phone number is 215-634-5272. There's additional information regarding a mail-in Narcan program on our slide, and Narcan is used to help reverse opioid overdoses. For abstinence programs, Alcoholics Anonymous, Narcotics Anonymous, and Overeaters Anonymous are great sources of information and socialization for people seeking assistance with addiction.
If you are a person living with HIV and need case management services to apply for any of the programs that we listed, please contact 215-985-2437.
This concludes our presentation on COVID resources for long-term survivors. We hope that you found the information helpful. You can find information on these resources and other resources on the Philadelphia COVID resources document. The link is located on the last slide of this presentation. Thank you.